We will begin with Dr. Nick Woodier. Nick is a qualified doctor with a background in emergency medicine. Nick is now a human factors specialist through the Chartered Institute of Ergonomics and Human Factors, undertaking investigations for the Health Services Safety Investigation Body. He will be providing us with an overview of the report published in December 2024 titled Mental Health Inpatient Settings, Creating Conditions for the Delivery of Safe and Therapeutic Care to Adults.
Let's start the presentations and welcome Dr. Nick Woodier to present on mental health inpatient settings.
Wonderful. Thank you, Debbie. Thank you, Debbie and Helen, for the introductions. And I can see my slides have popped up on the screen behind me. So good afternoon, everybody. My name is Nick Woodier. I'm a senior safety investigator with the Health Services Safety Investigations Body. I'll tell you a little bit about who we are and what we do at the beginning of this talk. And I've got 10 minutes to give you a little bit of an overview of our work in mental health inpatient settings. And as Helen said earlier, a particular focus on a report that we published at the end of last year, looking at creating the conditions in mental health inpatient settings for the delivery of safe and therapeutic care. Bear with me 2 minutes. There we go. First of all, thank you to Medstrom for the opportunity to come and present to you. We're a small organisation. We've been around for quite a few years, and so any opportunity for us to get our message out there about what we do is fantastic. We are an independent body, and there is a disclaimer on there on the slide for you. So HSSIB is funded by the Department of Health and Social Care to be the independent investigator of patient safety incidents and risks across healthcare in England, both the NHS and the independent sector. And we're legislated to undertake our work and publish the investigations that we undertake with recommendations made to national bodies. So bodies such as the Department of Health, NHS England, the MHRA, depending on what we've been looking at. All of our investigations are available via our website, which is on the screen, and there's a QR code there that can take you to that. We publish everything that we do, albeit that it is all anonymized, because part of our legislation is to protect the information and the identifiable nature of information that's shared with us. So we don't disclose who we've spoken to in our investigations. We don't name individuals or specific organizations or job roles in our investigations to help protect that anonymity. And it also creates a safe space for people to be able to have conversations with us around safety issues. But you can see on our website there's information about who we are and what we do and the legislation that sits behind our work. How we undertake our investigations and recommendations that we make, and the responses to those recommendations that we receive from national bodies. And out there on the right hand side of that top tab, you can see education as well. So we have an education program which is a significant part of what we do as well, which is to try and build capability across the healthcare system to undertake high quality safety investigations. So if you're not familiar with that, all of our resources are free to the NHS. Please do feel free to have a look, and there's a link and more information how to access the various different courses in there. But I'm here specifically to talk about our work in the mental health inpatient settings. And over the years, we've undertaken a number of different pieces of investigatory work in relation to mental health care and the support of safe and therapeutic care. You can see there at the bottom of the slide is just one example published back in 2021. But the top there is what I'm focusing on today. So in June 2023, we were tasked by the then Secretary of State for Health and Social Care to undertake a series of investigatory pieces looking at the safety in mental health inpatient settings. And that culminated in the publication of 4 separate reports, starting with the one that I'm going to talk about, and then finishing with the 4th one, which was published a couple of weeks ago, looking at various aspects of mental health inpatient settings, particularly in the NHS, but also into the independent sector as well, and made recommendations to various bodies such as the Department of Health to try and bring about change. So I'm going to be focusing on the report that looked at what we call creating the conditions for the safe and therapeutic care in mental health inpatient settings. But the 3 other reports that were published, if you're interested, and you can find them via our website, there's a piece around the transition of children and young people from children and young people services to adult services. There's a piece around out of area placement. And most recently, we've published a piece looking at learning from deaths and incidents in mental health settings. So that's a bit more around the governance aspect, but considering how best learning can be taken from events to minimize the chance of them happening again in the future. So when we approach our investigations, we use a number of different methodologies. We use a number of different tools, and this is just one of those tools. Some of those on the call may well be familiar with this because this is one of the tools that's advocated for by NHS England as part of the Patient Safety Incident Response Framework. So this is called SEIPS, the Systems Engineering Initiative for Patient Safety. And the idea behind this is it can be used to look at a risk or a hazard and think about what is causing that hazard and how to minimize it turning into harm. But it can also be used to look at where an incident has happened and track back from the harm that has occurred to a patient or to staff back through the system to understand, well, what were the different influencing factors that led to things going wrong? And this is just one of many methodologies, but the one that we have applied in the mental health inpatient work that we've undertaken. So when we undertake our investigations, we start from the point of looking at the outcome or the potential outcomes. And in relation to our recent work, we focused on, okay, so we want patients to be cared for in environments that support their recovery, support their improvement in mental health, but also avoid creating extra unnecessary other types of harm to them. So we've been exploring avoidance of physical harm to self and others, physical deterioration, so of a physical healthcare problem rather than a mental health care problem, but in a mental health setting, and then aspects related to psychological and sexual safety as well. But although our work is focused on patients, we do, of course, recognize that to have patient safety, you also need staff to be well and to be looked after, because if you haven't got the staff performing well, patients are not going to be supported, patients are not going to necessarily be safe. So as part of this work as well, we also looked at the conditions within which staff health and well-being can be supported, how those conditions can be created for staff to be able to practice and perform well, but also create those conditions for patients to be looked after effectively and to be provided with therapeutic support. So that's what we were looking at as an outcome. So the step back then, and I'm working from right to left of this diagram as you look at it, is we say, okay, for those different outcomes, we now want to understand the various processes involved in those outcomes occurring. And within the report, there are a lot of different processes that we've looked at. So I'm not going to go into all of them in detail here, which is why there's a very brief summary there of therapeutic care processes. But what we try to do is understand what those different care processes are. And then we move on to understand, well, okay, what are the different interacting, influencing factors that mean that those processes work well, in which case you get positive outcomes, or don't work well, in which case you get negative outcomes or unintended outcomes. And so, like I said, we focused on therapeutic care, we focused on mental health care as well as physical health care and mental health inpatient environments. And if you see the report, you'll see that there's a big focus in there around the workforce as well, and staffing, training and education, and that support for having the right people in post to be able to provide this care. I'm not going to focus on that aspect now. I'm going to focus on the wider creating conditions aspect. But I think it is important to highlight that whenever we're trying to understand why something goes wrong, we want to take what's called a systems approach. We want to think about all of those different factors in the system, in the world around patients and staff that are influencing things not working as well as we would like them to. And those factors are exemplified in the dotted box there you can see on the left. So workforce, we were looking at mental health inpatient services, of course, but there's a huge impact on the capacity and capabilities of community services on inpatient services. There's a lot in this around organizational and societal cultures and health inequalities across the piece as well. But more widely, we focused on those three elements you can see there at the bottom left. So estates and physical environments, that is the aging estates that we're seeing across the NHS and the independent sector that ultimately are not fit for any human being to necessarily be in certain situations. And the organizations are doing what they can with those very aged estates, but they are not necessarily always therapeutic, and they are certainly not necessarily always safe as well. But what you can see from the report, should you wish to have a look, is the factors that are meaning that organisations aren't able to address the risks in their estates. Yes, there are some aspects in that related to capital funding and access to finances, but there's other aspects as well that all come in together to influence why physical environments are not as therapeutic as we would like them to be. And as such, we have made recommendations to be able to support those environments to hopefully become more therapeutic, but also to be able to support staff in their work and create an environment within which we are not re-traumatizing people, and creating an environment within which there isn't over-sensory stimulation, for example. We spent a lot of time looking at the digital infrastructure, so that's particularly electronic patient records, and we know that that's a hot topic across the NHS now, and having interoperable systems, so that's computer systems that talk to each other. And a real issue we saw with computer systems across acute and physical and mental health care services not talking to each other, even in the same organisation, which means that people are falling through the gap in the middle, people are not getting follow-up, particularly for their physical healthcare needs in mental health inpatient settings, and sadly deaths resulting as missed or delayed care. So we've made some observations and shared some findings about improvements within the digital infrastructure and other aspects of the equipment in the environment as well. And then finally, as I've already alluded to, physical healthcare services. And we know that physical healthcare for people in mental health inpatient settings isn't as good as where we would like it to be. And what we found across the country when we were visiting very many different sites and estates was actually that there is a complete disconnect in lots of places between physical healthcare services from the acute sector and mental health care services. And there's a real opportunity here for integrated care boards, integrated care systems to think better about how physical healthcare and mental health can be more closely aligned to be able to meet everybody's needs and all of their needs at whatever setting they are in. That is a very, very quick whistle-stop tour of what was in that report, and more than happy to answer any questions or explore any more of these elements a little bit later as we get onto the question and answer. But please do feel free to have a look at the report, which is available via our website. And of course, there's the contact details for HSSIB should you wish to find out some more information. Thank you very much for listening to me. I shall hand back to Debbie and Helen, and look forward to some questions later. Thank you.
On behalf of everyone listening, I would like to thank Nick for the overview of one of the recently published reports by the HSSIB regarding mental health in patient settings.